Hello everyone, and thank you for joining us today for Ecolab's Public Health Matters webinar entitled Protection Starts with Prevention, Preparing for Flu Season. Our presenters today are Dr. John Hanlon and Mr. Vivek Raghavapudi. Before we get started, I wanted to make everyone aware of an upcoming Ecolab Flu webinar in Europe presenting on the topic of public health utilizing European illness data. If you have locations or customers in Europe, please take advantage of this opportunity to hear from a few of Ecolab's industry experts. It will take place on November 8th, and like this one, requires registration. If you have questions or need more information, please contact Victoria Rivers. Dr. Hanlon is Ecolab's Vice President of Food Safety and Public Health. In this role, he works closely with Ecolab research and development teams to develop new technologies and programs for safe water, infection prevention, and food contamination. Mr. Raghavapudi is Ecolab's Marketing Manager for Long-Term Care and Facility Care. Please feel free to pose questions during the presentation via the Q&A feature, and we will be sure to address them during the Q&A portion at the end. I will now turn it over to Dr. Hanlon.
Thank you, Corinne. In today's webinar, we'll begin by summarizing what we feel are the key takeaways from the information that Vivek and I are going to present. We'll then provide a review of what influenza is and specifically how it differs from the common cold. We'll also take a look back at last flu season and talk about what experts are anticipating for the 2016-2017 season. Then we'll cover tips for prevention that can help protect you and those who use your facilities from influenza. We'll then have some summary comments, and then we'll close with some time to respond to any questions that you type into the webinar's Q&A screen. So, simply stated, flu is a serious public health risk. It sickens millions of people in the U.S. every year. About 200,000 people are hospitalized, and between 3,000 and 49,000 people die from flu and flu-related complications in the U.S. each year. We'll discuss the fact that flu has a significant impact on businesses each year, but there are things that you can do, both as a business and an individual, to reduce infection risk for your customers, your staff, and yourself. So I'd like to share some facts and statistics about the flu. But before I do, one of the questions that I'm frequently asked is the difference between colds and the flu. So while both are respiratory illnesses caused by viruses, the flu is caused by the influenza virus, while the common cold can be caused by one of over 200 different viruses. It can be very difficult to tell the difference between a cold and the flu, but the last 2 points on this slide provide some distinguishing characteristics. Another question that I'm often asked is the difference between seasonal flu and pandemic flu. An epidemic of pandemic flu occurs when a non-human influenza virus gains the ability for efficient and sustained human-to-human transmission and then spreads globally. For both seasonal and pandemic influenza, the total number of people who get severely ill can vary, but the impact of pandemic flu tends to be higher. The last pandemic flu was in 2009. In terms of similarity, the points on the left-hand side of this slide summarize them well. And I think I've covered many of the points on the right-hand side during my description of pandemic influenza. So let's get back to seasonal flu. So the flu, as I mentioned earlier, is a respiratory infection. It's associated with fever and respiratory complications. As I mentioned, over 60 million people in the U.S. get the flu each year. Approximately 200,000 people are hospitalized. And tragically, anywhere from 3,000 to 49,000 people die from flu-related complications. 90%, again, 90% of seasonal flu-related deaths and 50 to 60% of flu-related hospitalizations occur in people 65 years or older. These next slides provide information on groups that are most susceptible. First, children. So 90% of flu-related pediatric deaths are associated with children who are not vaccinated against influenza. Children account for about 20,000 flu-related hospitalizations each year. I mentioned this earlier, but the second group that's most susceptible to influenza are adults over 65 years or older. And I think this is worth repeating. But again, 90% of flu-related deaths and between 50 and 60% of flu-related hospitalizations occur in people 65 years or older. I think many, if not all of us, can relate to flu symptoms. They include fever, myalgia, headaches, a non-productive cough, sore throat, and nasal inflammation. I've also noted additional symptoms that can occur in children. So when is a person infectious? A person is infectious 1 day prior to showing symptoms and up to 7 days after symptoms appear. The sneeze that I showed earlier reminds us that the flu infects us through droplet transmission. The images on the right show how easily the virus can pass from person to person, either directly through touch, indirectly through contaminated surfaces and objects, and through the air over distances of between 3 and 6 feet. The path of flu transmission is the same in a school setting, a work setting, as well as in your home. So with the paths of transmission in mind, how long does the flu virus survive outside its host? Virologists tell us that it can survive on hard surfaces like stainless steel or plastic for up to 48 hours, on soft surfaces for up to 12 hours, and the virus can survive on hands for up to 5 minutes. And while that sounds pretty encouraging, you just don't know when you've touched an influenza-infected surface. So let's take a quick look back at last year's flu season, and then we'll fast forward to the upcoming flu season. So the histogram that you can see on this slide is the result of the United States Center for Disease Control asking a very simple question. When is the peak of flu season? The answer, anytime between October and April. It turns out that when the CDC looked at data over 35 years, almost half the time, flu peaks in February. You'll see the 2 points on this slide. The peak of flu season last year was late December, and this past year, in March of 2016, just 7 short months ago, was in March. With regard to the upcoming flu season, it's too early for officials to predict its severity. However, their ongoing influenza surveillance enables them to give us a sense of when it will peak, and we'll know that as the weeks and months progress. Surveillance allows public health officials to predict the strains of the flu that are likely to be circulating. This information will be used to compare against the flu vaccine, and public health officials will have a better feel on how severe it will be. The other thing to remember is that the strains that are circulating really become the predictors for public health officials at the World Health Organization to design the flu vaccine that will be used next year. So at this point, I'll hand it over to my colleague Vivek to talk about how the flu can affect you, your business, and your employees, as well as the solutions offered by us here at Ecolab to help you prevent the flu and protect your business and even your brand. Vivek?
Thank you, John. Good afternoon, everyone. As Dr. Hanlon pointed out earlier, flu is a serious public health risk. It has a huge impact on our health and our businesses as well. If there's anything you take away from this webinar today, we hope that you understand the impact seasonal human influenza can have on you, your employees, and your business. Here are some statistics from CDC on the screen, and these numbers show the scale and impact flu has on our businesses. 66 million Americans get flu every year. 66 million again, and that's almost 1 in 5. And what does that mean to you? When an associate or when one of your employees gets flu, he or she spends close to 2.5 days in bed, misses another 3 days of work, and is sluggish for close to 2.5 days upon return. So that's a week of work that is lost. When you multiply that with the number of associates that get flu every year, you can see the impact that flu has on our business. To reiterate the point and looking at the impact in dollars, $16.3 billion per year is lost in earnings because of flu. And caregivers of children with flu lose on average 73 hours of work time if the child is hospitalized. You can see the impact that flu has on our businesses through the numbers on your screen. Hence, it is imperative that we give it all the attention and adopt certain practices to reduce the risk of flu. How do we reduce the risk of influenza? The best solution is to protect yourself by reducing the chance of virus transmission. And I'm going to refer to these 6 steps on the screen to minimize the risk of catching flu throughout the next portion of the presentation. The first step, and this is a critical step, is proper hand washing. Our hands are obviously what we touch things with, so touching a sick individual or touching an object like a tabletop that a sick person may have coughed over and then later itching your eye is a great example of how the virus can be passed between people and objects. To break that transmission between people and objects, you need to practice frequent hand washing with proper procedures. And by proper procedures, we're not talking about the splash and dash either, where you quickly rinse your hands in the water or wash your hands for a couple of seconds. Proper hand washing procedures recommended by the CDC recommend first wetting your hands with clean running water, then applying soap, then lathering the soap by rubbing your hands together, and taking care to wash the palms, between fingers, back of the hands, which most people miss, under the fingernails, and so on. Basically doing a very thorough job scrubbing all of the surfaces of your hands. It sounds funny that we're discussing about how to wash our hands here, but this is a critical step and I would like to draw your attention to it. CDC recommends this process, and this is interesting, CDC recommends this process take at least 20 seconds or about the amount of time as it would take you to hum the Happy Birthday song from beginning to end twice. So you can try this after the webinar. Once you finish the scrub, you then want to rinse well under clean running water and then dry your hands with an air dryer or a clean towel. The CDC also recommends the use of an alcohol-based sanitizing hand rub, what you may refer to as hand sanitizer. An important note here is that prior to use of an alcohol-based hand rub, your hands must be visibly clean. If there is visible dirt or soil, you need to remove it by properly washing with soap and water, as the soil could reduce the effectiveness of the sanitizer. Hence, you should only use an alcohol-based hand rub if your hands are visibly clean. The best way to apply a hand sanitizer is to apply the product to your palm and then rub your hands together until dry, such that the product covers your palms, fingers, and back of the hands. Basically doing a thorough job to ensure that the product contacts all of the surfaces of your hands. You need to use enough product such that it takes about 15-20 seconds for your hands to dry. If your hands dry much faster than that, then you're probably not using enough product and you may not be getting the sanitizing effect you desire. And of course, you can try the happy birthday tricks here as well. The second most important step is cleaning and disinfecting surfaces. Just as we talked about at the beginning of the webinar, hands and surfaces are both known culprits in transmission of the flu virus. So in addition to properly cleaning our hands, we also need to properly clean and disinfect surfaces. Cleaning and disinfecting is an important step in reducing the number of microorganisms, including the flu virus, that could be on the surface. It's a key step in reducing the potential that the next person to touch that surface will pick up virus particles and then infect themselves when they touch their mouth, nose, or eyes. And just as with hand washing, proper procedures are key for cleaning and disinfecting. Remember, you want to clean and disinfect the surface. An important point here is while we can clean without disinfecting, we cannot disinfect without cleaning. Hence, the first step is to make sure that the surface is clean from any organic matter. Any soil on the surface could potentially inactivate the disinfectant or shield the virus particles from the disinfectant. If there is visible soil, one option is to use a combination disinfectant cleanup product for both the cleaning and disinfecting steps. You can tell if your product is a disinfectant cleaner by reading the product label and looking for terms such as one-step disinfectant cleaner or cleans and disinfects in one step. In the United States, disinfectant products are registered and regulated by the U.S. Environmental Protection Agency or the U.S. EPA. So you want to be certain to use a product that is EPA registered. And you can find that information by seeing if there's an EPA registration number on the product label. You also want to look to make sure the product has claims against influenza. Please remember that not all disinfectants have claims against influenza. This information can be found in the section of the label that lists what organisms the product is effective against. Lastly, you also want to be sure to read the label section that covers instructions for use to ensure you're using the product properly. As with hand washing, proper product use and proper cleaning procedures are important to make sure your efforts spent cleaning and disinfecting are effective in helping to prevent the transmission of flu virus. In addition to properly cleaning and disinfecting of surfaces and hand washing, there are other steps you can take. As mentioned before, for the flu to be transmitted, the virus has to go from an infected individual to a new susceptible person who can become infected. You can reduce the risk of this sort of transmission through social distancing by staying home when you're sick and by avoiding others who are sick. Also, if you are, it's important to cover your nose and mouth when you cough, either by using a tissue or by coughing into your elbow. This helps trap the virus particles and prevents them from becoming airborne. And lastly, please get your annual flu shot. Vaccination remains the best protection in preventing yourself from becoming infected with flu. So with those prevention measures in mind, here are some key steps that you can take now at the very start of the annual flu season to help protect yourself and your employees. Keep in mind that these next recommendations are targeted towards building owners, managers, and supervisors. If you yourself are not in a position to implement these recommendations, then I would strongly encourage you to share these steps with someone in your organization who can. With respect to hand hygiene, you want to make it easy for people to do. This starts with making sure your facility provides products that are gentle on the hand, especially with repeated frequent use. Obviously, no one wants to use a product on their hands that is harsh and leaves their skin dry and cracked. You also want to consider placement of alcohol-based hand rubs and make them easily accessible for people in your facility to use. Studies show that if the products are easily accessible and available, they get used more often. And with both soap and hand sanitizer, you want to make sure your product stays stocked in the dispenser at all times. With respect to the second step, that's cleaning and disinfecting of surfaces, work with your cleaning staff to establish a frequency for cleaning tasks and provide guide cards which clearly show what those high-touch surfaces are. Also provide guidelines for how frequently they should be cleaned and disinfected. With both of these steps, that is hand hygiene and cleaning and disinfecting, you want to be sure to advertise and promote these steps within your facility and provide reminders to people about the importance of these steps. In our work, we found that customers and staff are receptive to overt signs and messages that cleaning is an important step in keeping their environments clean, safe, and healthy. Everyone appreciates a reminder every now and then, right? Talking about the other steps, with respect to vaccination, you want to make it easy for your employees to do it. For example, our company, Ecolab, provides an annual flu shot clinic held on site during the workday as a way to help make it easy for employees to get vaccinated. Additionally, find ways to make it low or no cost so that cost is not a barrier to vaccination. Many health plans cover preventive services such as vaccination and food. It's also helpful to advertise and promote getting your flu shot through posters and other promotional materials in the workplace. Our company does this through emails to employees and posters placed throughout our campuses. With respect to social distancing, as an employee, you have a lot of influence over this through your sick leave and attendance policies. You don't want a sick employee coming to work as they're likely to then transmit the flu to other co-workers. Again, you want to advertise and promote your policy so that employees know it's okay to stay home and in fact are encouraged to stay home when sick. Lastly, with respect to the cough etiquette, you want to make people aware of proper cough technique. The image shown on the right on the slide is an example of a poster Ecolab makes available to our customers to display in their facilities. It shows how to properly cough into your elbow or a tissue instead of your hands, and then reminds people to properly dispose of that used tissue and to perform hand hygiene. So now that we've reviewed these steps you can take within your facilities, how can you get help to implement them? I would encourage you to reach out to your suppliers to see how they can assist. We recognize that your suppliers may be able to provide some flu prevention materials, so please do ask them. Ecolab has a ton of promotional materials that we provide to our customers, reminding facility users about important things like hand washing and coughing into elbows. I will touch upon this later again, but Ecolab has a great hand care product line that is gentle on hands as well as dispensers that make hand sanitizers accessible and easy to use. We found that engaging graphics that communicate the importance of good hand hygiene are helpful as well. And lastly, please talk to your Ecolab representative to provide educational materials for your staff, students, residents, tenants, or guests. I would encourage you to not be shy about asking your Ecolab representative to help you proactively work to prevent the spread of flu in your facility. We are now nearing the end of our webinar, so I'll leave you with some closing comments. So summarizing the 6 steps again, the 6 steps needed to reduce the risk of influenza, the 2 critical steps are A, proper hand washing, and B, cleaning and disinfecting surfaces. These are the areas where Ecolab can really help you with some of the product innovations such as the Nexa hand soap and peroxide disinfectant which has influenza claims. For more information, please contact your Ecolab representative. Apart from the products and innovations, Ecolab is also well positioned to help you reduce the risk through proper procedures and training. And of course, your Ecolab representative is available at all times to consult on the best practices and help you put a program together to reduce the risk of influenza. To talk about more resources, you can find additional information on flu in general at these websites. I'll call out the flupreventionmatters.com site as a good starting point for general flu facts, as well as information on some of our solution offerings. If you're interested in organisms other than flu, I would highly encourage you to check out our virus primers, where we provide overviews of various viruses of interest, such as influenza, measles, norovirus, and others. This is an area of our website that public health experts such as Dr. Hanlon work very hard to keep updated and current to ensure that we are providing information on organisms of interest. And lastly, we have to call out the CDC website as a resource, and we encourage everyone to refer to it for public health-related information. The CDC provides a wealth of information related to the flu, including status of the flu season as well as tips for prevention. Here on this slide, as you can see, we've provided two links. One to the CDC website for the flu season we are now entering, and second, which is specifically targeted to long-term care employees. We know that several of you on the call represent long-term care facilities, so we wanted to make sure that you're aware of this great toolkit resource. With that, we have now reached the end of our webinar, and we will open the floor for any questions. As a reminder to everyone again, to ask a question, please use the chat feature of the webinar to type in your question.
Okay, we've got a question regarding disinfectants. Are all disinfectants the same? Vivek, would you mind answering that one?
Sure. No, not all disinfectants are the same. It's really important to always read the product label and information sheet to see if the disinfectant is firstly effective against influenza, and also to see what the disinfecting contact times are, as sometimes for some products it takes only 3 minutes, whereas other products take 10 minutes to be effective against influenza. I would highly encourage you to contact your Ecolab representative to walk you over the product label.
Do you have anything to add, John?
Yeah, I'll just add some commentary to that. Thanks, Vivek. The other thing to bear in mind is that the sensitivity or the resistance of both bacteria and viruses to disinfectants is not equal. There are some organisms, in particular bacterial spores, that are very, very resistant and are hard to kill. But Ecolab does have disinfectants that can kill bacterial spores. And viruses such as influenza are relatively sensitive to disinfectants, and they tend to be easier to kill. Something like a norovirus is more resistant. But to Vivek's point, it's vitally important that you understand the label claims that the disinfectants that you're using on your premises carry, and that as we're entering flu season, you want to be sure that you're using a disinfectant that carries an EPA-registered claim as being effective against the influenza virus.
Another question we have is, what is the difference between a disinfectant and a sanitizer? John?
Yeah, I'd be happy to answer that question. Essentially, both disinfectants and sanitizers inactivate microorganisms. Some will inactivate bacteria, others will inactivate viruses, and some both. The thing to remember here is that the standard of kill, so to speak, according to the EPA, for a sanitizer is less than for a disinfectant. The other thing to remember is that, especially in a food service environment, sometimes with the use of disinfectants, you need to have a freshwater rinse afterwards. So the message here is that it's vitally important that you follow what the label directions are for that particular application. Again, sanitizers have a lower level of inactivation versus the disinfectants, so they're not as strong.
Okay.
But again, label claims are vitally important. Right.
Expanding a little more on disinfection, we had mentioned cleaning and disinfecting surfaces. One question was, do I have to clean everything? Vivek, would you mind answering that?
Sure, that's a good point. your focus really should be on high touch points such as door handles, light switches, stair rails, elevator buttons, or telephones. Cleaning high touch points such as telephone at an increased frequency will really help you to reduce the spread of germs. High touch points is where the germs, and disinfecting them regularly will really help you contain or reduce the risk of transmission.
Okay. Let's switch it over to hand washing. How do I make a alcohol-based hand sanitizer available to my employees or guests or residents? Some locations might drive the need for different sizes or types. Vivek, could you expand on that for us?
Sure. So hand sanitizers come in various sizes you can offer. You can really offer small bottles to all employees. You can have larger bottles available on tabletops and counters, and you can have customized hand sanitizer stations located around your facilities. So depending on your facility and requirements, there will be a solution for you, and at Ecolab, we are always happy to help you find that right solution. So I would highly encourage you to, again, contact your Ecolab sales representative and figure out what kind of bottles you need at different points in your facility.
John, do you have something to add?
Yeah, I'd like to come back to, I think, a very good point that Vivek made about 10 or 15 minutes ago, and that was Vivek made the comment that overt signs of cleaner, safer, healthier are received very positively. Our research shows that they're received very positively by customers. That occasional reminder is okay, and they're also received very positively by staff members as well. So I would encourage you, as you're walking around your properties, you're walking around your facility, take a look at your hand washing signage and see if that needs to be freshened up. And really think about where you're currently locating your hand sanitizer stations. And if you don't have any on your premises, maybe tee that up with your Ecolab representative as to what options might be available. But again, couldn't agree more that overt signs of cleaner, safer, healthier really do resonate with both customers and staff, especially as we're coming into flu season.
And another question that we have about flu, actually, and another virus, norovirus. Does it present like the flu? And if so, what is a good cleaner to use with that? John, maybe you could kick that off, and then I can hand it over to Vivek.
Happy to, yeah. So, both are viral infections. Both actually have winter seasonality. So while we're rapidly moving towards flu season, we're also approaching norovirus season. In fact, 80% of norovirus outbreaks occur between that November and April time frame. So while they're both viral infections, they both infect very differently and present with very different symptoms. As we mentioned earlier, influenza is a respiratory illness. So we're dealing with infections in the respiratory tract and potentially the lungs. Norovirus causes acute gastroenteritis. So this really is a gastrointestinal illness. So the symptoms often of norovirus is vomiting and diarrhea being associated with acute gastroenteritis. The other thing that I wanted to remind you, and I touched on this earlier, norovirus is a much more challenging virus. However, our products and services can provide rigorous approaches to both preventing outbreaks of norovirus and even responding to an outbreak of norovirus.
Okay. And I want to touch on the cleaners and products that would be good and effective for norovirus specifically.
Yeah, absolutely. As I mentioned earlier, it's vitally important to check your product label to make sure that the disinfectant you're using has norovirus claims. So your Ecolab representative can certainly help you on that one. Ecolab has a number of disinfectants that have norovirus claims, such as the peroxide disinfectant I mentioned earlier. But please make sure that to contact your Ecolab sales representative, look at the product label and see what are the disinfecting claims against norovirus and also the proper use instructions to use your disinfectant against norovirus.
Okay. Anything else to add, John?
Yeah, just one other thing. We talked about similarities and differences. I want to just come back to a couple of slides that we showed where we talked about the morbidity and mortality associated with influenza being very significant in people 65 years of age or older. So that's a fact related to influenza. Another very important point, and now I'm jumping over to norovirus, is that the number one source for norovirus transmission is long-term care facilities. So norovirus is infecting the elderly as well. So it's just important to point that out. Definitely some similarities, but very much some differences between both influenza and norovirus.
Okay. Any other further points? I don't have any further questions, so I will move on. Vivek, would you close it out for us?
Sure, Karen. Again, on behalf of John and myself, as well as everyone here at Ecolab, we would like to thank you for joining us today. Ecolab is really here to support you in your operations, and if you require any support, please do not hesitate to reach out to your Ecolab representative or call 1-800-35-CLEAN. That's 1-800-35-25326. If you would like additional information on flu or need to reach John or myself for another topic, our email addresses are listed here, and you can certainly reach out to us. Again, as a reminder, we would really appreciate if you could complete the survey form that will pop up at the end of this webinar. We really value your feedback and it will help us to improve our future webinars. Thank you all again for attending today's webinar, and we hope the information we shared has been helpful to you and your organizations. Thank you for your partnership and have a nice day.